All right, let's get started with exercise. In this introduction video, we're going to go over all the fundamental concepts about how to use exercise to lose weight and to maintain weight and to improve your health. And then we'll have additional videos that go into a lot more details and some of the nuts and bolts about how to get started exercising and what some of your goals should be. Now, the traditional teaching with exercise is that you can burn calories by increasing your physical activity, and that shifts the balance in favor of burning more calories than you consume. And when you burn more calories than you consume, you lose weight. And it's this willing shift where we're in control of our calorie balance that causes us to lose weight. Now, from all of the other videos that you've been watching, you'll recognize that this is not how it actually works, because our body has a lot of impact in terms of how much we eat and how many calories we burn. We have this metabolic thermostat, and the metabolic thermostat is working to help you maintain your body weight at a certain set point. And so when we exercise, we sometimes are pushing ourselves away from that set point, and our body starts fighting back. Furthermore, when we look at the amount of calories that you burn from exercise, what we find is that they pale in comparison to the number of calories that we eat, even in a single meal. If we look at a moderate cardiovascular exercise, like say walking on the treadmill at a brisk pace or going for a brisk walk or using the elliptical, we find that over an hour, and an hour on the treadmill is a long time, and anyone who's done this can attest to this. Sometimes you can distract yourself by watching television or even reading a book, but in general, it still is a significant time investment, and for me, it's not something that I'm capable of doing. I don't have the attention span to do it, and I don't enjoy it enough to commit an hour of my life almost every single day to this. But if you are one of those people who can do this, you'll burn around 400 to 600 calories per hour on the treadmill. If we move into weight training, we find weight training we burn even less. And this is not the high intensity weight training, but this is kind of moving through the machines, lifting weights, not necessarily to the point of failure, but just enough to kind of get your muscles moving and create some resistance and move the weight around. But you're not really pushing yourself to your physical limits. We'll burn 300 to 500 calories an hour from that activity. If we look at the high intensity exercise, this is things like singles tennis or full court basketball or cross country skiing or CrossFit or boot camp or Orange Theory or any of these really high intensity exercise classes. We can burn up to 700 or even 1,000 calories per hour. But anyone who's ever done any of these activities recognizes that performing them at full tilt for an hour is extremely rigorous and requires a pretty good baseline fitness level to begin with, and it's not something that every patient that I see in the office is capable of. Now, when we look at our diet and we look at something reasonable to eat for dinner, like a Chipotle burrito bowl, not necessarily your best choice, but you can certainly do a lot worse, and if the bowl is properly constructed and you leave out the rice and you cut back on the animal protein and add extra lettuce and tomatoes and onions and things like that, it can be a very pound of cure friendly meal. But even something like that, which is a reasonable dinner, is around 500 to 700 calories. So in a single meal, in 10 or 15 minutes of consuming that meal, you can wipe out all that entire hour of exercise. And many people eat 1,000 calories or more at a meal. So the exercise really pales in comparison in terms of the number of calories you can burn compared to what you're eating on a daily basis. So it's a relatively small amount of calories that you're burning. Furthermore, because of your metabolic thermostat and the way it works to help shift and maintain this balance in the calories that you consume, and our body has this set point, and our hormones and our fat cells and our muscle cells are really working to help maintain a perfect calorie balance. What we find is that a lot of exercise where you say maybe you do the hour and you burn 500 calories. That night when you go to sleep, because your body's working against this extra calorie consumption, extra calorie burning, and trying to bring you back to your set point, you may burn fewer calories, even 500 fewer calories that evening. So the exercise, oftentimes your body revolts against it and it fights against the extra calories that you're burning and works to maintain your weight. And for most patients that I see in the office, exercise is not a particularly good way of losing weight, particularly if you don't perform it at a high intensity level. And we're going to go into detail about how you can use exercise and how you can lose weight using the right types of exercise movements. So let's talk about why exercise is important. It's something I do almost every day and I believe in strongly, and I think almost everybody out there can benefit from exercise and should try to work and figure out how to add this to your life, because there are a lot of benefits and you can lose weight. You just have to do it in a very specific way. So the number one benefit of exercise when it comes to weight loss is building skeletal muscle. Building muscle in your legs, in your abs, in your chest, in your back, in your arms, adding muscle to your frame and then using it vigorously lowers your set point. And without modifying your diet, if you exercise vigorously and you build muscle, add muscle to your frame where you can feel it in your arms and your chest, and you know that you're using these muscles and you're sore on a regular basis, this lowers your set point and allows you to lose weight. The second benefit is cardiovascular health, and exercise reduces your risk of stroke, it reduces your risk of heart attack, and it can lower your blood pressure and lower your cholesterol levels as well. So there are absolutely cardiovascular benefits to exercise, even if you don't lose a pound. Also, stress relief. Stress relief is critical, and many patients are gaining weight as a result of chronic stress in their lives. And a lot of these are life events or things in their environment that they can't control. If you need the job and your boss is terrible to you on a daily basis and causes stress, you're trapped in this situation, and it's going to be really hard for you to get and find another job if your financial life and all the other factors in your life are dependent on you having that job. So the only thing you can change is how you react to these things, and exercise is probably your single best tool to relieve stress. Far better than any medication, better than food for sure, better than drugs and alcohol. Exercise actually works to relieve stress. And finally, weight maintenance. If you've lost weight, we all know keeping it off is usually the hardest part. Most people who are watching this video have lost a significant amount of weight at some point. The problem is that you gain it back and then some. So exercise on a regular basis is a great tool to prevent the weight regain that inevitably occurs after most weight loss attempts. So let's discuss muscle mass. Muscle is the closest thing we have to the fountain of youth. The more muscle you have on your body, the lower your physiologic age, the better your mobility, the more strength you have, and essentially the younger you look and feel. Our goal with any exercise program is to build muscle. And this is easier for some people than others. If you're 25 years old and you're a male, building muscle is a very reasonable and possible thing, and you can add 10 or 15 pounds of skeletal muscle with the right exercise program if you're that person. If you're 70 years old and awaiting joint replacement, this is going to be a much harder task, but it doesn't mean it can't be done, and it doesn't mean that you can't gain some benefits from it and even lose some weight from it. So building muscle, adding muscle to your frame, and then using it in a vigorous manner at a very high intensity is a set point lowering activity, and it will bring your weight down and allow you to lose that weight. And as long as you're maintaining that muscle and using it vigorously, you'll stay there effortlessly. So cardiovascular health, I've got here the American Heart Association recommendations, and of course all public health recommendations generally are written to make it much harder to understand than it has to be. So the bottom line for this is that if for overall cardiovascular health, meaning reduce your risk of heart attack, reduce your risk of stroke, 30 minutes a day of moderate exercise 5 days a week is ideal. Now, if that exercise is vigorous, then you need half as much. So 15 minutes 5 times a week, or 25 minutes 3 times a week, add up to 75 minutes total. It's the same, but essentially it's either daily or close to daily, 30-minute exercise blocks or less frequent, higher intensity exercise blocks. All work to reduce your risk of stroke and heart attack. And for lowering your blood pressure and your blood cholesterol, of course, they come up with different recommendations, and this all has to do with the science behind it and where the literature can support certain exercise regimens. But for lowering your blood pressure, it's 40 minutes, 3 to 4 times per week. So slightly longer duration, maybe less frequent, and it's moderate to vigorous. So the intensity, if you're going to lower your blood pressure and cholesterol, the intensity has to be slightly higher. Now, the bottom line is remembering these things and following them diligently is really not necessary. The idea is that you should try to exercise every day if possible, or every other day if it's really vigorous. And 30 minutes, maybe 40 minutes is a pretty good time frame to do that in order to reduce your risk of heart disease and stroke. Now, if you do this, will you lose weight? Maybe, maybe not. It depends on your physiology, it depends on your genetics, it depends on your age. But in general, this level of exercise is probably not quite enough to drive a substantial amount of weight loss for most people. Now, stress, as we talked about in other videos, is a set point raising event. And chronic stress is something our body doesn't understand. We don't know how to deal with chronic stress. We get acute stress. If a lion all of a sudden popped out and bared its fangs at you, our heart rate would increase dramatically, our pupils would dilate, and we would be very physically primed to run as fast as we possibly could and do whatever we could to either fight off the lion or to run away from it. So the short period of physical stress is something that our body does understand and can react to. Chronic stress, whether it's from poverty, job stress, relationship stress, family stress, financial stress, whatever the cause of the stress is, where it's continuous and chronic and it's the first thing you think about when you wake up in the morning and it interferes with your sleep when you go at night, this chronic stress causes elevation in our cortisol levels and other hormones that actually work to raise our set point and trigger weight gain. So somehow managing or relieving stress is really critical if we're going to stop the weight gain and start moving the scale in the right direction. So there's really only 2 effective methods for relieving stress. People try everything. There's medications out there. In general, they don't work all that well. Benzodiazepines like Valium and Ativan are typically addictive and probably should not be used long-term for chronic stress management. For managing an acute stress, it's reasonable, but for something like financial stress, which is unlikely to resolve in a few weeks, it's not a good technique. Some antidepressants are a little bit helpful, but we're really talking about relatively small impact. Exercise and then meditation as well is absolutely a very effective way of reducing stress. And it doesn't take the high intensity exercise. It takes something as simple as a brisk walk or moving at a relatively slow pace on a treadmill or an elliptical, and it doesn't take an hour. 30 minutes or even 15 minutes can reduce your stress level. So when you're thinking about using exercise for stress, any form of exercise at any level of intensity will work. And it doesn't have to be the super high intensity exercise that's required for weight loss. So if you think that stress has played a substantial role in your weight gain, an exercise program with your goal being using it to relieve stress rather than using it to burn calories or drop your weight is a really great thing to introduce into your life. Now, weight maintenance, if we've lost the weight, we all know that as soon as you lose that weight, if you go back to your normal way of eating, the weight gain is inevitable. And pretty much anybody watching this video has lost weight and regained it and then some. So when we look at the scientific database we have called the National Weight Control Registry, which is a database of a large number of people who've been able to lose weight and keep it off for a prolonged period of time, we find that regular exercise is very common amongst these people. Now, whether the National Weight Control Registry is really just a group of people who have a specific genetics or physiologic state that makes them able to lose weight, or whether there's actually some behavioral advice in there that applies to everyone is unclear. But it still is worth looking at and recognizing that exercise as a form of weight maintenance after you've lost the weight is a great way to do it. And another thing we find is that maintaining a regular exercise program is typically easier than maintaining your diet over the long run. When we get into the habit of exercising regularly and we make it part of our daily routine, it generally is something that we're able to maintain for a prolonged period of time. And also, exercise is addictive. As you start doing more and more of it and releasing these endorphins that trigger the pleasure centers of our brain, you start to like it and it starts to make you feel good. And if you don't exercise, you feel bad. So when you get into that habit, and it doesn't happen at first, it only happens once you get into the routine, once you've built up some strength, once the workout doesn't hurt so much that you're able to enjoy it, it becomes the best part of your day and it becomes an easy thing for you to maintain. And then finally, there's a lot of studies out there that show that there's decreased weight regain if exercise is part of your daily life. So if you've lost the weight, and there's all kinds of studies out there, and what we see is if you lose a significant amount of weight, and we revisit people 18 months, 2 years, 3 years down the road, we'll see in diet, when the weight is lost through diet alone, we'll often see 90% weight regain. This is typically used as some form of very low calorie diet or severe calorie restriction program in these studies. When we add exercise to your weight maintenance program, we find that the weight regain goes to about 60% of the total amount of weight loss. Now, it's still not great, don't get me wrong, and they're using a technique that I don't agree with, a severe calorie restriction. But it points out that weight maintenance is really helped by regular exercise. So I'm going to cover a few final points that we're going to address in more detail in subsequent videos. The first is, when you exercise, the intensity of your exercise level, and probably the simplest way to measure that is your heart rate. But if you can really get that exercise up to a very high level of intensity, that's how you drive weight loss. It's not duration. And a 30-minute, really high intensity workout is far more effective for weight loss than a 60 or even 90-minute low intensity workout. So when we're working out, our goal is to push ourselves up to our limit. Now, if we're going to do that, there's a bunch of really important things that we have to do. Number one, injury prevention is key, because if you throw your back out on day 3 of your workout and are laid up for several weeks, you'll gain weight as a result. And many, many times people report to me that their attempts at exercise have resulted in injury, that injuries resulted in muscle loss. And again, our goal is gaining muscle loss and prolonged periods of inactivity, which is a set point raising event in your life. So whatever we do, we must prevent injury. And that's a critical thing to keep in the back of your mind. You're far better off ending a workout early and resting and getting back in good shape rather than pushing yourself and risking injury. The second is, the third point is that if you have minimal experience with exercise, if this isn't something you've done before, and something that you really understand and know how to do safely, and that means proper form and technique and knowing how to use the machines correctly, get help. Whether it's a physical therapist if your baseline fitness level is very low, or a trainer, whatever it is, get some help. But your goal isn't to use them for motivation. Your goal is to get them to teach you how to exercise, and then you go on and exercise on your own. So another point is, you've got to clear your exercise program by your physician. Now, if you're 25 years old and don't have any real health problems, that's probably unnecessary. But if you're on 3 or 4 medications and your doctor's been kind of watching you and following up with you a little more frequently, or you have a strong family history of heart disease, or you have any kind of chest pain or any symptoms when you exercise, extreme shortness of breath that is not what you'd expect, then you got to get things cleared by your doctor. You can't go into the gym and push yourself because you're going to risk having a heart attack or a stroke. And again, this is the exact opposite of what we're trying to achieve with exercise. So if there's any doubt whatsoever, get cleared by your physician before you start exercising. Another thing, and I think this is a really critical point, is exercise should be fun. And one of the best ways to make it fun is to find a friend. I find that when I work out with a friend, the workout seems like it takes half as long. It goes by much quicker. It's a great bonding experience, and doing it with a friend, suffering through it with a friend, that's kind of part of the human existence. And I find that doing that, making this your exercise fun, whether it's working out in the gym or playing tennis or basketball or something where you're enjoying yourself, and exercise is the best part of your day and something you look forward to, that's critical. If you dread your workout, if you hate it, if it's the worst part of your day, you feel isolated when you're doing it, you're not going to stick to it, no matter how disciplined you are, at least not in the long run. Remember, whatever we're starting here, we've got to continue this for decades. This has to become part of our daily life. And you're not going to continue to do something that you hate every single day without having some form of fall off or stopping. And then finally, your baseline fitness level, and we'll talk about how to determine that, as well as your age, play a huge role in whether or not exercise is going to be an effective tool for weight loss for you. So we'll kind of break that down further, but remember, exercise works well for some people and not so well for others. And if it's clear that you're not going to be someone who's going to be able to lose weight through exercise, then we've got to focus on other techniques like nutrition, even harder than you might have thought, and look at other techniques. And we don't want to risk injury, and we don't want to risk having some kind of adverse event from your exercise program. So it's going to work well for some people, others for not, and we got to understand that going into it so we make good decisions. So in the next video, we're going to specifically address how to work out when weight loss is your primary goal.